COVID was in the news and we hadn't experienced it in any way, it was mostly from what we saw on TV. And then staff were getting a little more anxious and what steps we were going to take. And then just like any game plan, then when it hit, it's like, the air leaves you. Okay, now we're there. The greatest strength Clearbrook had among the leadership is our honesty with each other. So no one pretended to know all the answers. And everybody was comfortable enough to share their vulnerability, their anxiety, as well as their thoughts and their ideas. So we shut down our day programs, and at the same time, our residential sites, we began to put them in isolation where we weren't allowing visitors in or people going home to their families.
So I think the first reaction for all of us was panic because of all of the unknown that was surrounding COVID back a year ago, and what that would mean for our individuals who are so vulnerable in so many different ways. And then quickly followed by action. What are we going to do? How can we continue to keep people safe? What are those things that we need to put into place to give ourselves the best possible chance of getting everybody through this as safely as we possibly can?
Although, we were planning and taking the necessary infection control precautions and having a backup staffing plan, we didn't know truly what was coming. And looking back, I don't think we could have ever planned for what actually happened.
When the client interaction stopped, and we really had to initially shut down and there was no client interaction, sometimes you joke about, I would just like one quiet day. And then that one quiet day came, I hated it. It was eerie. One of the big draws for GETS, I think, with a lot of people is you walk in and everybody greets you. All 200 people, hey Lauren, hey, whomever. And then it was just gone.
I was terrified that I would have 50 homes and no one would come work, and how would I do that? I don't have 50 managers that can go in an emergency. And in the face of this incredible fear, people got up and they went to work and they took care of folks.
We all look at our clients as if they are extended members of our family. So we had to do whatever we had to do to keep our family members safe.
And same with the staff, our biggest thing was keeping that energy, making sure that they were still involved and being able to still live their everyday lives without having the anxiety or the nerves or being scared of what's going to happen.
I don't think I'll ever forget that Friday afternoon receiving a call saying, that we have a choice. We can either take our children out, but they cannot come back for an undefined period of time. To be honest, my initial reaction was, are you out of your minds? And then we took a deep breath and we decided to leave Ira at his Scylla for a few days and kind of take it a week at a time.
We kept referring to it as creating the bubbles. So each one of the homes had identified staff and clients, and we kept basically everybody out of the homes other than that. Our managers often would go to the homes and they would have to peer into the windows. We were insulated for the first few weeks, which I really think bought us time to get the proper equipment and to prepare for it.
Early, my job changed pretty drastically. We were all kind of given our work to do when we went home. Within a couple days of that, everything kind of shut down, and I was tasked with inventorying all the PPE for the whole agency.
So we had regular routine use of protective equipment. But now when you start hearing the words pandemic, then when it hit us in a way that we started understanding how serious this was, all the supplies were necessary for everybody all the time. But we had to give that stuff, both so the individuals were protected that we serve, but also so the staff are protected and their families.
We all kind of had our contacts. We all talked about those and how to, tap all of those resources, and we did. From a random contact at Wall, we were able to amass about 10,000 face shields at a super low rate. I had a contact that was from the toy industry that I knew from 25 years ago, who had contacts overseas where we got 10,000 gowns.
I put out a post on social media asking if there's any sewers in the area that are willing to make masks for us. And I explained who we are at Clearbrook and what we do. I had hundreds and hundreds of masks that were donated to me that people made.
We really did have PPE everywhere. I had no room to walk in my office because there was PPE everywhere. I'm not over-exaggerating that.
Really unbelievable how people had stepped up in the most amazing ways. Meeting a family friend in a parking lot of a Portillo's to pick up hand sanitizer and hand soap and a bottle of Lysol. It certainly looked weird, but we did whatever we needed to do in order to keep people safe.
We first started to see COVID come in the beginning of April last year. An incredibly frightening time.
We had a resident that was not doing well. She's older, has some health conditions. It really didn't appear to be anything out of the ordinary. We sent her to the hospital for evaluation just as we normally would have, and I was sitting at my desk and I got a text from the administrator of the Commons saying that that person was positive.
So those first couple cases that we had were just gut-wrenching. We didn't know what to expect. We didn't know if the person would survive. We were so concerned about everyone becoming ill. And the people we serve, quite frankly, are very delicate, have underlying conditions.
It wasn't just one at a time, it was 1, 2, 3 at a time. People were going up to the hospital, and that went on for days, and the phone just didn't stop ringing. And people kept going up to the hospital, and people got sicker, and staff were getting sick and unable to come in.
There was one night we called in less than 2 hours, I believe, 5 times. And every time they came back, the same paramedics, that they had to start rerouting people to different hospitals. I think that because, again, they were scared, they were like, can't you handle some of these cases there? Because they didn't know where else to take our guys.
We had some of our Wilkie ladies whose vital signs were not quite in the normal limits. And so we had to call 911, and they wouldn't come in the house. And that was one of the scariest things that I've ever experienced, because I didn't know how I could keep everybody safe and what I could do when those that I call aren't able to help us.
And then as people began to stabilize, then another thing we hadn't thought of is that these clients were still very sick, and we're not skilled care. And so where did they go from the hospital when they were stable enough to leave there, but still COVID positive and still very sick?
So we have a varying degree of individuals that live in our homes and levels of understanding. So we really tailored our message to each individual person based on their learning styles.
If I tell you that you have to quarantine and you understand why, you understand the consequences and you'll comply more. A lot of our folks don't really know what we're talking about when we talk about these things, so we really have to work with them. And sometimes it's a matter of, if I have to quarantine you in a room, I'm gonna have to spoil you. We're gonna bring some games to your room. We're gonna bring meals to you. We're gonna try to make it a game.
I received a phone call that Ira was fine and didn't have COVID, but basically the other 3 boys did have COVID. It was a tough time for the house. It was a tough time for the staff. It was a tough time for the parents. They certainly did something right in how they quarantined everybody, because the staff never got it and Ira never got it.
As people were brought to the hospital, the staff kept coming back. And their job's hard enough as is, but now they're going to take on these risks for themselves and then going back to their families. I didn't think that they'd be up for that. I questioned if I'd be up for that. And so when it did hit at that level, and they just kept coming.
I choose to stay, and I talked to some of the other co-workers too. I told you that you did not have to worry about me not coming to work. I will be there every day. This is my Clearbrook, my comments, and we're in this together, and I'm not gonna run away.
I was blown away at their just, like, we're here, we're gonna be in it, and everyone kind of banded together.
The way the staff responded, the staff that have the hands-on job, the work, the reason they did it, the love for the people that they're serving, the courage they showed was just incredibly humbling.
One young lady, Tatiana, she left her shift and went to another facility, didn't even have time to go home and get clothes or anything, and stayed with us for, I think, 4 days straight. She went and slept in one of our empty community day services building during the day, and then she would work 16 hours. Sometimes they didn't have time to go home, sometimes they didn't want to go home because they were afraid they would bring the virus home, which is really how we got to the point of offering hotels for staff.
Jessica recognized right away that a lot of these staff are working double shifts, are exhausted, are feeling that anxiety but holding it in, and then they're going home, and a lot of them are moms, so they're going home terrified they're getting people sick. She called and said, "Can I want to get hotel rooms for these guys and we can give meals." I said, "Definitely, do whatever it takes." And we did that, and they were so appreciative. Staying at a hotel was a big event, and having a meal brought in was a big event, but that's the least we could do for what they were giving to this organization and to the people that we serve.
Our nursing department is small. They were taking on a huge workload. We had one nurse in particular, very early on, go to stay at a hotel, and she left her 9-month-old baby with her mother. I can't imagine doing. I mean, an ultimate sacrifice that she made for our clients. Their work environment changed also. So to come to work, they had to put on a mask, sometimes 2 masks, a face shield, goggles, a hair covering, a plastic gown, which was really, uncomfortable. And then they had to go work for 16 hours or longer. And they did it with a smile. Without that group of staff that worked through the heart of the outbreak, I don't know what would have happened.
One of the things that's been so remarkable to me through all of this is looking at how people are reacting. And I've gotten a lot of compliments on how staff have responded to this. And I think there's an assumption that somehow they're not scared. And I would tell you that that's not the case. There has been a lot of fear, but there's been a lot of bravery, and I don't think you can have one without the other.
Early on, we knew we were asking our staff to risk their lives for their job. Nobody signed up for that when they came to work at Clearbrook. And so we knew that we needed to acknowledge that we know what you're doing is really hard and risky.
I think it brought us closer. We were all in it together.
We had a plan. This is how we're gonna make it work. This is what we're gonna do. Not only the staff at the Commons, but the whole administration. So that was very nice, and that's what I will always remember.
Throughout the whole challenge of COVID, our missions never changed: enriching lives and embracing potential. Despite COVID, that continued. Someone had a son who plays violin and can make people feel better and make it fun and unique. All of a sudden, that kid is put on the front lawn of a group home and playing music, and the people in the group home, all of a sudden, they're pumped up because they're getting a private concert. Or staff who decide, we're gonna play, we're gonna organize a parade. And so they get posters and whatnot, and they drive from group home to group home, and the group homes start calling the next one, hey, they're coming, they're coming. And all of a sudden, from fear and boredom going on in the homes, there's excitement and anticipation, the parade's coming.
did a Halloween day just for fun. We did Fancy Friday, just to get people up and moving. I was Santa this year too, which
Yes.
was so much fun.
Yeah.
I came in on Christmas Day, and then having a white mask under the beard, only one client knew who I was.
They tried to do fun activities. We as parents also brought food and groceries and tried to do as much as we could, both for our boys and for the staff.
Meals were more special. Games became a big deal. A walk became a very big deal.
The residents were rock stars. I mean, having to make a change of staying home and not going to day program and then having to stay in their halls and in their rooms, I mean, truly, they handled it probably better than the general public did.
Our clients always amaze me with their resiliency and their perseverance with how they handle these challenging times.
One of the big things that we were finally able to do when we had that short break in the summer where the numbers started to go down and we had the advantage of good weather is we implemented outdoor visits. A lot of tears of happiness. The summer was a really fun time to see people get together.
They invited the parents, if they wanted to come, to socially distance and be in the backyard and kind of cheer them on. And it was so much fun because that was the first time that we saw him at his house.
We brought one thing that we wanted to share because I thought it just sort of summed up the whole experience.
This was
Christmas. We did Christmas brunch in the garage, and if you remember, Christmas morning was not warm at all.
He was worried about, well, what about the Christmas traditions, things that he really liked about Christmas. So we'll work it out.
We had brunch casserole and we opened presents, and he brought out his little tree from his room and put it on the table, and we had the lights, and we did as good as we could do. And I think that kind of sums up the whole year, as you did as good as you could do.
You know, the word was coming out, vaccines were going to be available. So we were kind of sorting that out and hoping and really thinking maybe March, maybe April. You know, by April, we'll get our vaccines. And
thankfully, one day we started to get vaccinations. We were among the first people to get vaccinations. And that wasn't by accident. That was all of us being very squeaky wheels, and we eventually got the oil. But that's because we had a lot of people really working at it.
It was a Friday in January, and I got a phone call from one of the directors over at the Commons that said, can you call this lady back from Jewel Osco? They want to give us some vaccines. So she was calling to ask me how many doses I needed, and I felt like I won the lottery. This was a Friday, and she said, okay, so we're going to come on Tuesday. And I was like, well, okay, because I wasn't going to say no.
I was so happy. I was thrilled. I was thrilled.
It was like Christmas morning for some people. They were like, oh my God, we're getting the vaccine.
When I found out Ira was being vaccinated, I was beyond appreciative and grateful and relieved.
When we heard that Clearbrook was going to start with these clinics, there was a pretty overwhelming sense of excitement. If we can get through these vaccines, then maybe we can get back to the wonderful crazy that it was before.
when we had the clinic and you saw faces you hadn't seen in months, and you weren't gathering because of something sad or painful, but you were gathering because you were doing something that was going to change it all, it was beautiful. Clinics were set up first to take care of those people that were living with us, the residents, and then the staff that were providing service and supports to them. But we continued to go forward. We began to offer vaccinations to those individuals that were living at home with their moms and dads and their sisters and brothers.
It was the best work day ever, is all I can say. It was exhausting, but it was so worth it. And they brought in so many people to help administer the vaccines, and they were so great with our clients. It was the turning point for us that there is an end in sight. There's a light at the end of the tunnel.
We had a vaccine clinic at the Getz building for our community clients. That was incredible because we haven't seen the community folks in a year now. I really had to hold myself back from like running up to them and be like, oh my gosh, I missed you. I kept myself together. So a ton of people from all aspects of Clearbrook came together to help with this, whether it's taking temperatures or signing people in or assisting if there's an individual who's really scared to get the vaccine.
And they went out and vaccinated people in their cars who weren't comfortable getting out of the car and coming into the building.
And sometimes it takes a lot of bribery, it takes a lot of cajoling, but you use every tool in your toolbox. And oftentimes when we were going through it, getting folks, it was bribing them with ice cream, getting people to get their arms up, oh, someone's been hitting the gym, look at those guns. Just kind of getting people excited about it. What we've learned for our next clinic is we need more chocolate ice cream.
The families were so thankful. A lot of the clients were like, hey, that kind of brought this energy to them as well. You know, once I'm vaccinated, once we're vaccinated, we can have some kind of normal.
We were very happy to get that opportunity because there was no other place that was offering the vaccine for her age group.
He hasn't been anywhere except to go to doctor's appointments since March 8th of last year, okay? Taco Tuesday come March 30th he's going to, huh, Sean?
Yeah.
Okay.
It was a gift. We knew that there was just a limited opportunity and we were trying to capitalize on it for Jack.
I feel secure and safe knowing that you guys are going to help me. You know, it gives me a very safe feeling.
Our families were so grateful that this vaccine was going to be offered to their loved ones. And then the next question right after that was, when can I see them and when can I take them home?
I am really looking forward to him being able to be productive and go back to his day program and be among his peers and be out in the community. I can't wait for him to be out in the community again.
Today there were the comments and the residents were out, they were walking around, they're happy.
There's been a lot of really hard things, and I would venture to say even more wonderful things because of it.
For me, this past year has been very difficult. I mean, for everyone, but the happiest moment I think was this last week. We had like a mini dance party and like the staff joined in, like the speech pathologist was in on it. And honestly, it was like the happiest I think I felt because the clients were so happy. For like the first time in a long time, it wasn't this like dark cloud.
And so I think everyone will be affected by the pandemic, but to have the support of the community and the families of the people we serve, that kind of support was priceless at a time when we needed it the most.